Moderna applies for a patent for a vaccine in 2016. This is all in the open now. We are in the era of biowarfare. We will be attacked with a pandemic. It will happen. It's right in the legislation. And when it happens, there will be emergency countermeasures that will be immune from liability. Now you hold in your hand and you hold a vaccine in your hand. Can you imagine how much power you would yield? We've got locked and loaded. We've got a vaccine to save the world. I think one of our agents could spill this on a New York subway. Let's talk about reducing tariff. Don't look to your government to save you. It's clear. There's not a single government in the world that's going to take these off the market. What's going to save you is independent research. Look to the McCullough Foundation. Look to this podcast and where so many other experts come on. Do your own research and be wise in your choice. America's already spoken. No one's taking these shots. The public is not taking vaccines.
Spike protein detox, long COVID. Why did the shot make some people more sick than others? Heart attacks. We're going to talk all about that, but I'm here with the expert. He needs no introduction. All right, Dr. Peter McCullough, thank you for being here.
Thanks for having me.
You need no introduction. I mean, why bother? I mean, everyone knows your work. Everyone knows of the controversy. You stepping out. I do want to tell a little bit of that story because you stepped out when others wouldn't. You immediately gained the respect of so many people in, at least I'll say, the natural health space, right? And then I believe you ended up gaining the respect of many people around the world because you were right. Yeah, and that's, we can say that now.
Well, you're so kind, but thanks. By way of introduction, I'm Dr. Peter McCullough. I'm in practice as an internist and a cardiologist. I'm also a research epidemiologist. And I lead the McCullough Foundation as the president. I'm also the chief scientific officer of the wellness company. But let me say, when this pandemic hit, it was the bioscientific and medical opportunity of a lifetime.
Yeah.
And what was shocking to me with this brand new problem was how the blue ribbon academic medical institutions provided no innovation. They provided no novel approaches. And we'd expect within a few months that Harvard would be leading the way with the Harvard protocol to treat COVID-19, or the Mayo Clinic, or the Northwestern, or out here.
Well, and wouldn't they argue it was remdesivir and ventilators?
But that's not novel.
Okay, yeah, but
right.
I mean, they would argue though that was the treatment. I mean,
well, wait a minute. It's a brand new virus. There is no known approach, and they have to wait for a government-provided remdesivir. So the idea is, before remdesivir, what were they doing? Do you see what I mean?
Yeah.
So Paxlovid, the first oral drug for outpatient use, that comes in 2 years into this. What did they do for 2 years to treat patients to avoid two bad outcomes? There are always just two bad outcomes, hospitalization and death. So what were all of these medical institutions doing to help their patients avoid hospitalization and death? They had a 2-year period of time to come up with something. And I have to tell you, I am shocked. My colleagues at Harvard, and I was an endowed visiting professor there in 2019. I lectured in 2 departments. I am ashamed that my colleagues at the blue ribbon institutions could come up with nothing in 2 years.
well, it begs the question, why? I mean, why? Why didn't they? Why? Let's hear it.
Not a single one of those members of the Department of Medicine or the Department of Infectious Diseases has ever come out and explained why they came up with nothing. Nothing. And people have criticized me and said, "Oh, Dr. McCullough, you published a protocol using clinically indicated, medically necessary, off-label generic drugs and nutraceuticals and supplements and nasal sprays and gargles and available emergency use authorization products when they became available." They criticized me. Well, you can't do that. You can't do that. I said, why not? We have 2 years of nothing that's formalized for outpatients. When I published my first
you think
protocol,
they'd have been aggressive around this, saying, let's see what your outcomes, let's see the outcomes of some of these things.
Or let's put it into operation warp
absolutely.
speed,
Instead
right?
of just criticizing,
Right.
I mean, they immediately went after, I don't know, were you one of the first that said, hey, ivermectin makes sense here? Hydroxychloroquine makes sense here?
I was the first to publish a comprehensive multi-drug treatment protocol for high-risk outpatients. High risk meant elderly, people with medical problems, heart failure, emphysema, not for everybody, not the healthy young person, but for high risk individuals. And I published it in the American Journal of Medicine in August of 2020. Now listen, that's a very highly ranked journal.
Yeah.
It was the most widely read paper in that journal for several years. I got 6 letters to the editor. It's very interesting. From prestigious institutions like Duke University and Monash and McGill down in Brazil. And the letter said this: Dr. McCullough, you can't do this. You can't treat outpatients with COVID-19. You don't have enough evidence. You don't have enough evidence. And when I testified in the U.S. Senate, November 19th, 2020, this is before the vaccines, the minority witness, Ashish Jha, who became the White House coronavirus coordinator, his central argument was, you don't have enough evidence. So here we're getting to the root problem.
Why the pushback? And this could be your theory.
Well, this is my theory. When there's tremendous fear, and we're talking about fear of stepping out and treating a brand new illness, and there's fear of potential criticism, potentially fear of malpractice, although there was broad coverage under the CARES Act to cover people. But when there's fear, the safety is in groupthink. So the idea is, if I'm at an academic institution, I'm going to stay safe. And I'm going to just declare there's not enough evidence. There's not enough evidence for me to do something. But I'm going to go criticize Dr. McCullough and his other witnesses in the U.S. Senate. So it was not enough evidence. So my response to the letters to the editor was pretty fun because as the time went on, more and more evidence came in that we could do something. I would essentially enjoin them. I'd say overcome your fear. Overcome your fear and help patients get through this potentially calamitous, potentially fatal illness. And as we did our analyses, by December of 2020, we had clear and convincing evidence that multi-drug treatment was working to reduce hospitalization and death. No specific drug. It typically took about 4 to 6 drugs in combination. And conversely, those being hospitalized and dying, it was because of a lack of early treatment.
Yeah, interesting. So here's the thing, right? So they see this, their methods aren't working. Remdesivir, I call it your death is near, right? I mean, the statistics there, I mean, arguably that was killing more people, than the virus. I don't know. Do we have statistics on that? Did it kill more people than the virus?
Let's get the evidence out in remdesivir, because early on, a few of my patients were hospitalized, and in my hospital system, they did receive remdesivir. I didn't have a single patient who could actually get through the 5-day infusion protocol because of the kidney and liver toxicity. And I was looking at this drug saying, wait a minute, this is toxic stuff. But the WHO comes out in November of 2020 and says, broad proclamation with the European Society of Critical Care, do not use remdesivir. The November of 2020, do not use remdesivir. It doesn't.
But they continued.
It doesn't work, and it has potential toxicities. Now listen to this. The United States plunges forward with enhanced reimbursement for remdesivir use in the hospital.
That explains it.
Okay. So the WHO in May of 2022 in Lancet, the WHO Solidarity Research Group revisits this and says, wait a minute, were we wrong? So they analyze more studies that have come out with remdesivir, and they reiterate their initial guidance. Remdesivir doesn't work. Don't use it. So to this day, no one's ever asked Anthony Fauci or Ashish Jha or anyone in White House Task Force 1 or 2, why did the United States administer remdesivir when the WHO and their research group says not to?
I'm going to get you in trouble. Should he be in jail, Fauci?
Unprecedented. The backstory is here. He approached Biden for a preemptive 10-year pardon.
Yeah.
That he asked for clemency
it had to have
for
been.
Crimes he knew he must have committed. And so what could be the crimes are outlined in my first book. And those crimes are almost certainly fraud. That and it's fraudulent concealment of the origins of SARS-CoV-2, the Wuhan lab. He knew. The House investigations have demonstrated that. But also, fraudulent portrayal of early treatment, hydroxychloroquine, ivermectin, the other things. Right?
I mean, he was criticizing those when there was a lot of evidence that it was working better than anything.
Listen, if a doctor in the field believes these products worked and kept their patients alive and out of the hospital, that's all you need to know. Early on in the pandemic, we'll never have enough evidence. That's the point I'm making.
Right.
It was a time for courage,
right,
and it was a time for judgment, and we were not seeing that from practicing doctors by and large and from our government agencies. But the second crime Fauci committed is mass negligent homicide. And you can ask, how? What's the mechanism? By two mechanisms. One, he actively worked to undermine and suppress early treatment, which was saving lives. And then the second thing he did is he relentlessly promoted unsafe and, for some people, lethal vaccines.
Many feel more people died from those treatments than the virus itself. And I don't know those statistics, but I mean...
Well, let's do a quick analysis. The current number of test-positive deaths during the pandemic. Now, test positive at any time and death at any time. So it's a very loose definition. That's the definition of a COVID death, is 1.2 million Americans. The National Center for Health Statistics has published, as of 2023, that half of those deaths had no pneumonia on the record at all. So could not have died of COVID. So now you cut that down to 600,000. And studies that have done adjudication, weeding through the charts, did they really die of COVID? Did they die of something else? Have gotten that number down somewhere under 10%.
Wow.
So as we sit here today, I think 120,000 Americans did die of COVID. I had a patient in my practice, two of them. One died with acute COVID. He was my patient. I took care of for a decade or more. I know for sure he died of COVID, about my age, by the way, but prior bypass surgery, prior atrial fibrillation, valve disease, and got treatment, but got it too late before he got in the hospital. And then the other patient who died, and I count him as a death, is a hemodialysis patient who got, patchy early treatment because he was in and out of the hospital, but he survived to 90 days and he was found dead at home. Those are my only two deaths.
I mean, so 120,000, I mean, that's not a lot. I mean, I don't want to minimize this, but, it's not a lot in comparison to what we thought it was, right? So when you look at $120,000, it's tragic. And this virus decimated people's health, because even now we're dealing with it. We're going to talk about that, what post-COVID.
So
but the death rate, that shocks me, is what I'm saying.
Well, 97% of us got the illness.
Yeah, absolutely.
Okay, so I got it. Did everybody here in the studio get it?
Yes. Got it.
Everybody got it. So when I do public programs, I ask for a show of hands. Virtually everybody raises their hands. So serologic data suggests 97% of us got it. Can you imagine this? If this would have been forecast correctly by our public health agencies to say, listen, announcement, everyone's going to get this. Just get ready.
Absolutely.
Everyone's going to get it. The goal is to get through it at home with early treatment measures. That's the goal. But instead, the assumption was you can avoid it. So wear a mask so you can avoid it.
My video got taken down because I said my family's goal is just to get it as quickly as we can and just go about our business.
Right. So can you imagine? Wear a mask to avoid it. Shut down your business to avoid it. Shut down schools to avoid it. You can actually get by without getting the illness. How about contact tracing? Do you remember that? Who touched who? Who touched who? Who kissed who? The bottom line is...
It violates everything that I know about virus and transmission.
We have very bad forecasting. Yeah. That's my point. So Fauci committed these crimes. He knew he did, and he sought unprecedented 10 years of preemptive clemency. I mean, people ought to let that sink in.
Yeah.
So we have a situation where a pandemic hits. There is global suppression of early treatment. Early on, there appears to be only one truly endorsed solution, and that's mass vaccination. We see wide open corruption now. Now the corruption is in the open. And the public in United States was not bad. But let me tell you, there's some countries, people couldn't leave their house for a couple of years.
That's crazy. That's amazing. I mean, it's absolutely insane when really, I mean, come on, scientists, doctors that are, in the know that it had to be natural herd immunity that is the only thing that stops a virus. Proven to be true. Everyone got the virus. I think even the people that didn't get it, they got it. My wife, I just said, she had no symptoms. She wasn't on the couch. I was, but later she goes, oh yeah, I have lost her sense of smell. I mean, we found her antibodies. Her antibodies are up. So she got it even though she was symptomatic free despite losing her smell. Now, so there was others like that. So when we finally we had trouble getting COVID. We were trying to get COVID. Okay. Yeah. We were literally, my friends was like, my kids were like, hey, my friend has it. I'm going to bring him over. Bring him over. Let's get COVID. Didn't get COVID. So we went to her birthday party. There was 30 people in the room for her birthday party. Everybody got COVID except one person. So he's 80 some years old. And I said, hey, you better call Pi because, we all got it. We're fine, but he may not be. Do you know, he never got it out of all of us. Yeah. He never but he got it. He had antibodies to it. So he got it, but he wasn't symptomatic. Why is that, Peter?
Well, there was cross immunity from other coronaviruses. There were 4 beta coronaviruses that we could have gotten. That was shown in multiple papers. So it may have had cross immunity. He may have had a very small inoculum early on. So remember,
he drinks about 2 bottles of wine a day. Is that an inoculum?
But the inoculum is kind of the amount of viral load. And it is kind of also faces this inverse factor of mucus flow. So it turns out people with good mucus flow, they tend to flush out the virus so it doesn't set up shop in the nose. So early on, there were randomized trials of nasal sprays and gargles. This is absolutely amazing. There was a large clinical trial by Chowdhury and colleagues using a dilute iodine spray and gargle. They even used dilute iodine eye drops. Marked reduction in the symptomatic duration of COVID, in the severity of COVID. Then the trials went on. There was a trial by Baumforth and colleagues using a xylitol-based nasal spray. That was done during the heat of COVID. There was a 70% plus reduction in the incidence of acute COVID-19. It was better than a vaccine. So there's been about 24 studies, nasal sprays and gargles. The CEO of the company that makes xylitol in the United States clear, he's right here in Salt Lake. You should interview him.
Oh, yeah.
Nate Jones. Nate was doing research, publishing the results on his website, just publishing the results. Looks like this spray looks pretty darn good. The Federal Trade Commission goes after Nate Jones, sues Nate personally and his company here in Salt Lake, which employs lots of good people here, for violating an FTC COVID misinformation policy. This goes on for 4 years, trying to drain him and his company dry of legal fees. Trump gets into power. Lawyers change out, experts change out. 2 FTC officials fired by Trump. Nate gets a letter saying, we're dropping everything.
So the only thing that makes sense here when I hear that is they knew this vaccine was a cash cow. They knew where they were going with all this. So they had to shut down anything that wasn't a vaccine. Why would they come after something as innocent as ivermectin, right? I mean, the safest, cheapest drug. It's been around forever. I mean, if there's a list of drugs, dangerous drugs, it's probably in the top 3 that are the least dangerous drugs, right? So, and yet it ended up absolutely being effective. It was early on people recognized it was effective. So the fact is that they were doing this because they didn't want another answer. I mean, that's the only explanation I have for that.
I completely agree. People have said, well, it was a technicality of the emergency use authorization legislation. Not the case. Remember that the very first EUA drug was hydroxychloroquine, which it didn't need an EUA. Right. It was already on the market, so it had an EUA temporarily. That was withdrawn. And then the next one was remdesivir. That was inpatient treatment. Then the next one was November of 2020. That was bamlanivimab. That was a high-tech monoclonal antibody that was safe, and it was effective in high-risk patients. So listen, there was nothing wrong with Operation Warp Speed when it came to the monoclonal antibodies. But what did we see? There were 6 of these, and as soon as they came out on the market, the agency said, you know what, these probably aren't going to work. We're pulling it off the market. Yet the nation purchased enough to treat every single person. There was enough monoclonal antibodies around. And we were screaming for monoclonal antibodies. We said, listen, every nursing home should have a stock of these. Yeah. Every emergency room patient should have gotten a monoclonal antibody. There's no reason why they shouldn't have before they came into the hospital. These drugs reduce mortality significantly, yet they were quickly made unavailable. They were hard to find. They were not administered by ERs. This was stunning. There should be nothing wrong with giving a monoclonal antibody. So I agree with you. The only explanation is the public health agencies and governments worldwide wanted one strategy only. It was mass genetic vaccination.
Yeah, and I tell you, that's right, genetic vaccination. Very different than any vaccine that's ever been introduced. So the science was way too early, but they wanted this out there. Okay, let's back up just one second because, so COVID, right? Do you believe COVID was a man-made virus, or do you believe COVID was, well, what they said?
Came out of nature?
Yeah.
That's been so vetted now that, it's on every single website of our intelligence agencies. Yeah. The House investigations have all concluded that it was created in the Wuhan Institute of Virology by a U.S.-Chinese team. And the main architect is Ralph Barrick at the University of North Carolina, Chapel Hill. Mm-hmm. Anthony Fauci was a global supervisor through the NIAID. And then a key go-between is Peter Daszak at the EcoHealth Alliance. So he had, probably hundreds of trips back and forth to Wuhan. And then the lady who actually does the work is Xingling Li. She's the bat lady in Wuhan.
The bat lady.
And so they're creating this virus. Barrick publishes 2 papers in 2016 announcing that he's doing this. Yeah. One was in Nature Medicine. The other one was in Proceedings of the National Academy of Sciences. They called it a SARS-like CoV-1 Wuhan Institute of Virology virus. And they said, listen, it's a chimeric between a human beta coronavirus and a bat virus, and it was designed to invade human respiratory epithelial tracts. And in the same papers, they're trying to come up with a vaccine. So they memorialize this. Moderna applies for a patent for a COVID-19 vaccine in 2016. This is all in the open now.
Yeah. Okay. So I guess why people would be asking, why would they want to manufacture this? But you kind of just answered it. You kind of said because alongside it, they were coming up with the solution.
Right.
And they knew that if they can create a worldwide virus with a solution, that's...
Well, you hit the nail on the head. We used to hear about nuclear proliferation. We used to hear about, missiles and missile defense systems. Now all we hear is about biolabs and biowarfare. And this was memorialized with the 2003 Biowarfare Act and then 2005 PrEP Act. The PrEP Act, HHS and Congress wrote this in 2005. They said, we are in the era of biowarfare. We will be attacked with a pandemic. It will happen. It's right in the legislation. And when it happens, there will be emergency countermeasures that will be immune from liability. They're going to be richly supported. And so when that was posted, there was a huge race by researchers to come up with what's called pathogens of dual potential. And the Biden administration has the legislation on this last summer calling this. That means the pathogens can be used to make the whole world sick. They can also be used to create a vaccine. And there's legislation on this. So these biolabs existed all over. Temporarily, the National Institutes of Health had a ban on funding to this. So it wasn't a problem. Barrick and Peter Daszak just take the money over to China. So they're just going to outsource it. But that ban, went away. We have 14 biolabs right here in the United States, just as bad as Wuhan. One of them's in Galveston, Texas.
I've heard.
There's been hundreds of leaks. And you might ask, what's the purpose of creating the coronavirus? And recently, 2 sources of information. One I had on my show, the McCullough Report, Jim Haslam. He's an investigative reporter. Jim has really researched this, and recently former CDC Director Robert Redfield has come out and said this. What they were trying to do is they were trying to come up with a vaccine, a self-spreading vaccine, which would have been the virus, to vaccinate bat populations. That's what they were trying to do. So bats are a vector for some bad illnesses. And the theory was, well, if we could actually vaccinate a bat population with a coronavirus self-spreading infection where the bats got immunity, we could actually terminate some of these zoonoses. So in Haslam's research, and it did meet the peer-reviewed literature in 2018, the primordial COVID virus was here in the United States. So Barrick had it, and Fauci's group had it, and it was at the Rocky Mountain Research Laboratory in Hamilton, Montana. They got about 30 or 40 buildings there. It's a secluded campus, 400 employees, and they were trying to get the virus to invade Egyptian fruit bats. It's published in the peer-reviewed literature. Haslam has a book out on this. It's very well written. It didn't work. It didn't work. But what did happen, and what I think has happened, is it was unintentionally, leaked out of the lab.
Yeah, obviously.
And then once it got out, you saw the response to it in the emails that Fauci was receiving. Like, oh, listen, boss, this got out of the lab. What are we going to do? And they started writing in code, and they knew that they were going to get caught. Probably the most flagrant deception was by Peter Daszak, who's now debarred from the NIH, and the EcoHealth Alliance is said to be impoverished. But in White House Task Force 1, Rear Admiral Brett Giroir, who's a really honorable person, he went to medical school just a few years ahead of me at Southwestern. He was approached by the WHO early in 2020 and said, listen, we want an investigative force to go to Wuhan and figure out where this thing came from. Brett Giroir nominates 3 independent U.S. scientists to go to Wuhan. He submits their name and resumes to the WHO. The WHO says, no, thank you, Dr. Giroir. We want Peter Daszak. So at that moment, we knew the WHO must have been in on it. So Daszak goes to Wuhan. He's been there many, many times before because he's helped create the virus. And Daszak looks around. He does his investigation. He goes, I don't know where this virus came from, but it didn't come from the Wuhan lab. Well, he knew very well. He helped create it in that lab. So he intentionally deceived America and the world as a leader of the EcoHealth Alliance. There's been multiple whistleblowers inside EcoHealth that have written books on this saying, listen, this guy deceived us. And if the government would have come clean and they would have said, yes, we are working on this virus, it was from the Wuhan lab, and it has these characteristics. It is unassailable in terms of breaking it down. Enzymes can't break it down. We could have gotten a big lead on this. I think with some honesty, we could have gotten a big lead on this. And I think our government officials should have held monthly meetings with doctors in the field like myself to say, listen, what is working? What are you doing that's innovative, that's keeping people out of the hospital and getting people to survive the illness? Do you know the government didn't hold a single one of those meetings? It took Ron Johnson to November of 2020 to hold the first hearing on early treatment. I was the lead witness. And do you know that video was scrubbed off of YouTube? Yeah. C-SPAN, the government video agency, was censored by all forms of media, never was on CNN, never was on Fox. It was completely suppressed. So news that we could treat COVID patients was intentionally suppressed by what we call the biopharmaceutical complex. And I want to show my first book that we wrote, Courage to Face COVID-19, Preventing Hospitalizations and Deaths.
On Amazon, I'm sure.
While battling the biopharmaceutical complex. We outline every step of what happened in this early suppression of treatment. Now, this book gets out of the gate. It's self-published on Amazon. Then the Skyhorse picks up the hard copy and was published under their Children's Health Defense print label. This book is on Amazon for 18 months. 5-star rating. We get a note from Amazon saying we're taking it down.
Of course.
We're taking it down.
Why?
It's a piece of literary art. It's not a Twitter account. They're taking it down. We ask why. They said it has offensive content. Well, we had a review on this. We had a legal review. It doesn't have a single cuss word in it. I don't cuss. It has no nudity, no profanity, no hate speech.
Of course not.
It's just a gripping depiction of what happened.
That's the offensive part, by the way.
How did Joe Rogan get involved? How did Tucker Carlson get involved? It's all in my book. So,
man, that's a read right there.
Yeah, and it reads fast. It's not a boring medical book. John Leake is a best-selling author. He knows how to engage the reader, and you can read it in a couple days. So there's a whole response, and the civil liberty attorneys and opinions rise. Like, listen, this is, you can't just ban a piece of literary art because of somebody doesn't like it. And after 10 days, Amazon said, we made a mistake. It's back up.
Interesting. Who put the pressure on them? Where was that coming from?
John Lee.
No. I mean, meaning to get it banned in the first place.
Tony Lyons and some people I can't mention, but they're pretty high up there. But when we get to the point of banning books, think about this.
Yeah.
That, there was memes on social media, on Twitter, showing the brown shirt, agents from the Third Reich, and instead of having swastikas on their sleeves, they had Amazon patches.
Yeah.
Well, thank goodness, it was published in Barnes & Noble. It was self-published on Amazon, a children's health defense. So our sales skyrocketed during the 10-year. Yeah. And everyone's like, well, it's banned. This must really be telling the truth.
Yeah, exactly. It must be, yeah.
And it's a factual account of what's happening.
But I'm glad you showed it, because I don't think a lot of people, it kind of caught a wave, but it needs to catch another wave. People need to know this information.
Right. And you and I lived through it.
Yeah.
In a chapter, there's one chapter early on, it's called To the Best of My Ability. And my dad was in Dallas. And he has dementia. He had fallen. He had a hip fracture. He's flat on his back. And he's one of the first senior citizens in a care facility to get COVID. And they contact me and said, your dad's got COVID. And the early version of this is the Wuhan early version of the virus, is severe. I said, he's a goner. He's just not going to make it. I said, but, I talked to my wife, my mother, my dad, and we had to make a decision. Are we going to follow the government protocol, which at that time was to do nothing, zero? My dad said, listen, I'm not going to the hospital, and I'm not going on a ventilator. Those are out.
Man, that was smart.
Those are out. And I talked to the physician assistant was there. The doctor just left. The doctor in charge of this care facility just left. And this was a very good one in Dallas. And the physician assistant says, we're moving your dad to this.
What month was this, by the way?
This was April of 2020.
Oh, wow, yeah. Okay.
So they move him to this building they're not using. They make it a makeshift COVID ward. And I said, will you take orders from me? I'm a licensed doctor in Texas. They said, yes, tell us what to do. I said, open the windows. It's a beautiful spring in Dallas. They said, why? We never open the windows. I said, because there is a re-inoculation. The virus is in the air everywhere. If you keep breathing it in, you're going to get fresh air. Have the windows open. Oh, if it's cold. I said, put a sweater on, Dad, but I want the windows open continuously so he doesn't re-inoculate himself.
That makes sense.
The poor PAs, they were wearing hazmat suits, if you can believe that. And so there's my dad wearing his old grandpa sweater. And then I said, start hydroxychloroquine, start azithromycin, start vitamin D and vitamin C and the nutraceuticals. Yeah. And he received an early primordial version of the McCullough protocol. Now, he got very sick. He got to the point where they said, listen, it's not looking too good. His blood pressure is slipping down. He's not drinking. He's not very coherent. And we checked some labs. His serum sodium had risen to 151. Mm-hmm. And normally serum sodium is 140. It's tightly regulated. It gets to 141 or 142. It's uncontrollable thirst. Can you imagine what he was like at 151? And I said, we need to put in an IV. And they could not get the IV. His veins were so contracted. So they literally put an IV in his abdominal wall in the fat, and they dripped in the fluid like you would for a baby. And Dad survives COVID. So he gets through COVID. Now, interestingly, he tests positive intermittently 17 times. 17 times. And the way that the test count took place, There's no check for duplicates, by the way.
Right.
So my dad counted for 17 cases of COVID.
Oh, wow. Yeah.
So when we were seeing these case counts,
case counts were irrelevant.
Yeah, because of the PCR testing was known to be grossly false positive.
Yeah, right. It depends on how many times they even duplicate it, right?
Correct. Correct. So my dad survives, and back then we didn't know the effect of corticosteroids. If I would have known, I would have put him on steroids. It would have helped greatly. But do you know that when Dr. Pierre Corey was called by Brian Johnson to testify in a Senate briefing in May of 2020 about steroids, and Corey was making the observation that if patients in the hospital got steroids, they recovered. Do you know at that time the National Institutes of Health guidance was do not use corticosteroids. Infectious Disease Society of America, do not use corticosteroids. All the medical groups do not use steroids. Worldwide, the TGA in Australia, do not use steroids. Corey goes in and said, listen, steroids are working. I'm using this in my practice, and I'm watching this happen. And within 6 months, studies came in, and guess what? They showed that steroids were working. Then all the agencies said, we should use steroids. The point is, we should always follow clinical judgment ahead of clinical trials in the setting of an emergency. Corey was right. I was right. Hydroxychloroquine was partially effective. It turns out it probably had about a 25% effect. Ivermectin, as you pointed out, that was the star.
Right.
And in a study in the second U.S. Senate hearings, I asked Dr. J.J. Rush to present from Florida. He published a study called the ICON study, and it was published in Chest, a prospective cohort study showing that ivermectin reduced mortality in inpatients by 50%. What I'm telling you is every single hospitalized American should have received ivermectin.
Yeah.
And hospitals categorically refused
and
to provide it.
and ventilators were actually causing death, the opposite.
Right. They should have been giving ivermectin.
50% versus the other percent causing death.
Right. It made things worse. And the point I'm making here is that this was systematic, and we have, and I testified in the Senate to this, the fact I think 85% of the lives lost could have been saved. Yeah. That's how important early treatment was. And if we ever have another pandemic, we should never look to a vaccine. A vaccine, by the way, is a bad strategy for a pandemic. And I'm the only public figure.
Yeah, but they made billions.
I'm the only public figure in the world who questioned the vaccine before it came out in 2020 in writing, big time. You're looking at the only person in the world. All these other people in the health freedom community, they actually were seduced by this idea.
Well, everyone was even afraid to stand up against it, because if you did, they made it very clear that you were going to be banished.
Right. But listen, in August of 2020, I had been writing op-eds in The Hill, which is one of the most widely read journals by the House, the Senate, and the White House. Scott Atlas at Stanford was chosen. I was at Baylor at the time. I was chosen. We were writing op-eds. Scott was focusing on the contagion spread issues. I was focusing on early treatment. When I got to the vaccines in August of 2020, the title of my op-ed, and it's still on their website today, is The Great Gamble of the COVID-19 vaccine development program.
And let's talk about the vaccine, because it was the great gamble, right? But it was calculated from the beginning. I don't know if this whole thing was created it's hard to believe it was created just for the money grab of this vaccine, or if they have other plans, right? I almost have to ask the question before we exit that. Is another one on its way? Another planned pandemic? What's your opinion?
Almost certainly.
Okay.
Now, CEPI, the Coalition for Epidemic Preparedness and Innovation, that was founded by the World Economic Forum and the Gates Foundation, they've put out over 100-page white paper, Disease X, the next pandemic is coming. Tedros Ghebreyesus, who leads the World Health Organization, Disease X is coming.
But why?
Because Disease X, which is the next pandemic, is going to come out of one of these biolabs. There's too many of these biolabs making dangerous pathogens. They can't control them, and they're going to leak out.
Like from the top down, why are they making them? Is it just about the money they're going to make on the solutions? Is it about world population?
No. Think about money and power. Remember I mentioned nuclear proliferation and defense systems. Can you imagine if you are a country like Ukraine?
But there's a lot of biolabs, evidently.
Right. Or or you're a independent group like the EcoHealth Alliance, and now you hold COVID-20 in your hand, and you hold a vaccine in your hand. Can you imagine how much power you
So
would use?
they create the weapon and they create the solution.
And they say,
and they create the power.
Well, can you imagine, what if China comes to the table, Trump's trying to negotiate tariffs, and Xi comes to the table with some of his scientists and said, hey, listen, Mr. Trump, we've got COVID-20 locked and loaded. We've got a vaccine to save the world.
Mm-hmm.
I think one of our agents could spill this on a New York subway. Let's talk about reducing tariffs.
Okay, yeah. So it's more than money. It's about power.
There you go.
And that absolutely makes more sense from the top down. The drug companies did get bloody rich over this, obviously.
Tens of billions of dollars.
Yeah.
Remember a blockbuster drug before the pandemic. After 20 years of research and $500 million of investment, a blockbuster drug, by that definition, would earn $1 billion in its first year. $1 billion. Can you imagine having all the development costs covered by the government, having no sales and marketing, have government purchase, and then
you can't get sued.
And you can't get sued, no liability.
No liability.
And then earn tens of billions of dollars.
Oh, and you don't even have to prove safety with a double-blind placebo trial, which is, by the way, all vaccines, for those who don't know that. But yeah, so it's the only drug you can't be sued. It's the only drug you don't have to prove safety.
Well, in our book, we outline, we define a new term, which I think is really stuck. And the title of the book is The Courage to Face COVID-19. And then the subtitle is Preventing Hospitalization and Death While Battling the Biopharmaceutical Complex. And that's what I felt like I was doing. I was battling a cartel.
Yes.
I was battling essentially now a congealed organization.
You had no idea what you were battling in the beginning.
I had no idea.
If you knew, you might not have stepped in.
Oh, my Lord. This cartel is dealing in trillions of dollars.
Yes, trillions.
Now, you say, well, who are members of this cartel? We outline in my book, for sure, the World Economic Forum. For sure, the World Economic Forum, the World Health Organization, the United Nations, lots of powerful NGOs, Gates Foundation, Wellcome Trust, Gavi, CEPI, Unitaid, Rockefeller Foundation.
Yes.
Okay, so they exist. The regulatory agencies, FDA, CDC, NIH,
they're all in it.
MHRA in the UK, SAFRA in South Africa, TGA in Australia, EMA in Europe. They're all connected. And then it turns out the vaccine companies, they're the suppliers. This is important. And so it wasn't just the vaccines companies that made a lot of money. It was companies that did testing, that made personal protective equipment. They're all part of this complex. And this business, the pandemic business,
it's bigger than the drug companies.
So rich.
It's bigger than
way bigger than drug companies.
Pharma.
And so you can imagine, if it's one pandemic after another, can you imagine the amount of money that can be generated?
But it really is about controlling the world, because if you control that, you control the world.
For sure.
Yeah. I mean, this is, like you said, it's bigger than building nuclear weapons, because if you have this stuff, nuclear weapons do you no good whatsoever. So now it allows a country like China to have a foothold, a say.
Oh, my Lord. Well, on Fox News, and I was a frequent contributor.
Does Trump know all this? Everything you just said?
I would imagine. I mean, I know
Bobby knows.
I know Ron Johnson very well. And, even country western star John Rich had said this. Listen, they've sat with Trump for hours and explained all this. Mm-hmm. For hours. Ron Johnson, for sure. He goes, listen, I've been on Air Force One.
Yeah,
Trump knows every aspect of the suppression of early treatment and every aspect on the dangers of the vaccines. For sure. For sure.
No doubt.
And so does every world leader. So here we are today. We have the COVID-19 vaccines, of which in America, 81% of Americans took at least one shot. 70% of Americans took 2 shots. Now, you and I are in the 19% that took no shots. A lot of people in the audience today didn't take any shots. So when you didn't take a shot, or you don't have a disease of interest as a doctor, you can be objective. This is very important. But when you are participating in whatever's going on, you can't be objective. Mm-hmm. This is very important. Do you know back in the day, And I gave a Chautauqua lecture on this earlier this year. Back in the day, 1860 to 1920, the medicine of the day was cocaine. It was in all the medicinal products. All the big drug companies had cocaine.
Well, now it's Adderall. It's the cocaine of the day.
Think about this. 1860 to 1920,
Ritalin, Adderall.
1920, the doctors could not be objective. Every paper was extolling the virtues of cocaine. JAMA, which was around since 1860, JAMA, during that period of time, had one paper of concern regarding cocaine addiction. One. Because the doctors were self-participating.
Did you see The Nick on Netflix?
No.
Oh my God! You have to. It's the history of what you're just saying. It's the history of medicine. But like the top doctor of the time in New York, the Knickerbocker Hospital, he was addicted to cocaine.
Well, there you go.
He was participating.
Well, Halsted at Hopkins, the father of modern surgery, became a cocaine addict. So did Sigmund Freud.
Yeah.
So now
you have to watch the Nick.
It sounds fantastic. If you go forward though, the next epoch is 1920 to 1978. Smoking addiction. Do you know virtually every doctor smoked?
They all
every
smoked.
Nurse,
yeah.
R.G.R. Reynolds, Philip Morris, American Tobacco Company. They had physician smoking campaigns. Doctors gave out cigarettes in their office.
Yeah.
Everyone smoked. And so when Richard Dahl, a UK physician, and Sir Austin Bradford Hill in the UK, a epidemiologist, have compelling data that smoking causes lung cancer, the doctor's like, no way.
No way.
No way. No, not in me.
Yeah, exactly.
Right, not in me. And this goes so far as we have Luther Terry. Now, we're talking about a real public health hero. Luther Terry, 1964, calls all the doctors to Washington chiefs of medicine. So listen, I got bad news for you. The Surgeon's General report on smoking is conclusive. Smoking causes lung cancer. The doctors are like, no, that can't be true. This is now 14 years after it's been proven. It wasn't until 1978 before the AMA comes out with their first campaign about the hazards of smoking, and it's not until 1990s before we have the tobacco settlement. So what I'm saying is when doctors are wrong on something, they don't correct quickly, and it takes decades.
Man.
Now we're into the era of vaccines, and that's my follow-up book, Vaccines, Mythology, Ideology, and Reality, and this is a New York Times bestseller.
Look, in this seat, my last interview here was Del Bigtree with an inconvenient study, right? And that inconvenient study just happened to be the first big study anyway done by Henry Ford Health Institute, where they looked at the vaccinated versus the unvaccinated. The gentleman who did the study was pulled into it, convinced to do the study, to finally shut down because it was very pro-vax, that, this would end the argument that the vaccinated group is going to appear healthier. Well, 6% increase in autoimmune, 2.5% all-cause mortality, autism, 2.5% increase in the vaccinated group versus, did you see the film yet?
Yeah,
you have to see it.
Let me just comment. I'm a former official at Henry Ford Hospital. I was the associate director of the Center for Clinical Effectiveness and the program director in cardiology. So I've received a legal letter.
Oh yeah, I know.
From
yeah, you
Henry
can't
Ford,
say a word probably.
And I did appear in the documentary, and I wasn't forewarned that I would review the study. But let me say that, and over 130 studies now are in the McCullough Foundation report on the determinants of autism, the most important document that's been produced on autism so far. We've been waiting for decades for Health and Human Services to come out and tell us, where is all this autism coming from?
Right.
It's
just we're diagnosing it better, Peter.
Well, when you and I were kids, it was 1 in 10,000.
Yeah.
As of 2022, according to CDC, good data, it's 1 in 31. 3.2% of kids have it. 27% of those kids is profound autism. Yeah. They're going to be needing lifelong special needs, can't communicate, hang-banging, screaming.
If it was happening at the same rate and we're just better at diagnosing it, we're all the adult.
We would see it in adults.
Exactly.
Listen, I'm in clinical practice. I didn't see this decades ago.
No,
I now have young people in my practice with autism.
No, of course.
I have young adults. We're seeing this all over. It's being normalized as neurodiversity. But what we found in the McCullough Foundation report, which includes all available data, is that, and 82%, by the way, is new information from the 2004 Institute of Medicine report, which basically said the connection between childhood vaccines and autism is theoretical. That's what their conclusion was. We now have 79% of all the published information supports a link between childhood vaccination and autism. So it's a complicated illness. There's no single cause.
Yeah, that's right. I agree with that. It's a perfect storm.
Multiple risk factors.
Yeah.
So older parents, a man over 35, a man over 40, woman over 35, premature delivery before 37 weeks, common genetic variants, and I mean common, methylation.
Yeah, common stuff.
They're common
SNPs,
things, common. And then prenatal exposures, but we're talking heavy-duty, day-by-day prenatal exposures like anti-epileptics.
Acetaminophen, as we just learned.
Antipsychotics, and then antidepressants, not Tylenol. This is very important.
So you believe Tylenol, it's not one of the things.
Come on, a pregnant woman gets a headache and she takes a capsule of Tylenol. 3 years later, her child develops autism after vaccines. That's related. No.
What about its relationship to folate pathways in the brain? Obscuring that. No dice.
Now, if a pregnant woman every day was taking a Tylenol overdose for 9 months,
a different story.
Maybe, yeah. So there's a very convincing paper by Altquist, published in JAMA in 2004. They looked at millions of pregnant women from 1996 to 2021. They captured every capsule of Tylenol taken. They captured what happened to the children, what the other problems the women had and fathers had. And very importantly, they analyzed siblings. It's very important. So you had the same mother, the same father, one baby. The mother took some Tylenol during their pregnancy. The other baby, no Tylenol taken. So they have it down. The bottom line is women who did take some Tylenol, yes, there were slightly higher rates of autism.
Is that what RFK was looking at when they looked at this?
That's what they overlooked. It's very important. So this Altquist study is the definitive study. The point is, women who took Tylenol, there was a slightly higher rate of autism. But when they control for taking opioids and antipsychotics and all these other things and a family history of autism and siblings, when they control for all this, Tylenol is not related. I mean, it's a convincing study. It was published in JAMA. And when RFK and Trump came out and said, well, it's Tylenol.
Yeah, but they were also saying, but the bigger problem is vaccines. Trump was saying that.
You know what my diagnosis was on this is that RFK told America, we're going to have an answer on autism by September. They had no answer.
Yeah.
They obviously didn't do what we did at McCullough Foundation. They didn't do a comprehensive report. And so they felt like, gosh, we need to say something. So they organized this press briefing. And I'm pretty sure they're just going to go out and say, listen, we're concerned about the vaccines. I think that's what happened. And
that's what I felt like.
Yeah,
and it was almost like they didn't want to say it. Bobby didn't want to say it, but Trump was like, I'm saying it.
Okay, you got it. So I almost seemed like this was going to happen. And then somebody came in from the vaccine industry or lobby and said, listen, pin it on Tylenol.
Yeah.
Tell him it's Tylenol. And Trump's like, what? So Trump gets out there. He goes, well, I think it's Aceta. How do you say this? And then Trump quickly gets off whatever they're instructed to say by the vaccine lobbyist. And Trump goes, well, listen, there's too many shots and the kids are getting autism and this and that. So Trump stays on the talking point, and you can see Kennedy's face like, oh boy, we need to get back on the deception plan.
Yeah. Because Trump's like, well, he has no filter, right? Because he's in the back meetings, and they're like, okay, we know it's the vaccines, we know it's the stacking of that, we know it, and then so he just was like, I'm saying it, right?
Yeah,
I mean,
so Trump said it. Kennedy kind of gets around to it later on. Kennedy says, well, 40 to 70% of mothers believe the vaccines played a role in their autism. So he says it. But to mislead the nation and say it's Tylenol when it's clearly not.
Yeah, but they know it's the vaccine. And the studies are already indicating this. I mean, they're newer studies that they're doing, but they wanted to wait until they had like smoking guns and everything. And,
listen, they haven't. The McCullough Foundation is...
Trump blew the lid off it.
Well, listen, we were a month afterwards. We were grant funded to do this. It's unassailable. It's already published in the European preprint server. Not a single credible doctor has criticized us. We had a few ad hominem. We basically delivered the goods. Now, the CDC has a $9 billion budget, 12,000 employees, a lot of people just with my type of, my background. They can't generate a report on autism? Come on.
Come on.
I mean, what do? Sit around all day? They don't, the CDC, with that budget and manpower, They don't deliver any health care. They don't run any clinics. They don't staff any hospitals. What do they do all day? Provide you and me recommendations? That's all they can do? But my point is, it was a bad move to try to pin it on Tylenol. And, the manufacturer of Tylenol, Kendall, they came out and said, hey, listen, we've never told pregnant women to take this. But now there's lawsuits between the government and the manufacturers of Tylenol. And on CNBC, they had some commentary by Kendall's being acquired by another company, by one of their leaders. And he said, listen, I'm quite positive about our prospects of legal warfare between us and the government.
Do you think that because, Bobby is obviously pinned on, he's an anti-vaxxer, it was almost kind of convenient to take some of the pressure off that it came out with as something that it's not just vaccines. Hey, look what else we found. I mean, it was just...
He is caught because he wants the job. He was told by somebody to pin it on Tylenol. It's obvious they had to make a makeshift change in what they were going to do in the press conference. That was the most uncomfortable, disjointed, herky-jerky. And you know what? Immediately, no one believed it. Immediately, American College of Obstetrics and Gynecology and Pediatrics, everybody came out and said, no, it's not Tylenol. This has been clearly investigated. I came out and said, it's not Tylenol.
Yeah.
And people said, well, Tylenol, a dose of Tylenol impairs the glutathione pathway. It's like, come on. A dose of Tylenol.
It does, but not to the extent.
There are so many redundant systems.
Yeah, right.
The human body.
And they said impaired the folate pathways in the brain as well.
Listen, it's so transient. It's in and out of the body quickly.
Yeah.
Now, listen, if a woman was literally taking a bottle of Tylenol a day, every day for 9 months, it's possible. But I'm much more concerned about taking an SNRI or SSRI for the full duration of pregnancy. That came up in our report. Or taking an anti-epileptic like Lamictal, or taking an antipsychotic like Haldol or Stelazine or something like this. So heavy-duty drugs during pregnancy could play a role. Now, think about this. Yeah. Drugs that impair synaptic transmission between neurons chronically over time, they could impair a developing human brain to have a different configuration and be predisposed to a neuropsychiatric problem. But what we know is 20 vaccines, and we outline this in our book. 20 vaccines in their package insert say they can cause encephalitis.
Yes, brain inflammation.
And the picture of what we're seeing for autism and related disorders, which are attention deficit hyperactivity disorder, tics, which are involuntary movement, as well as epilepsy, is a post-encephalitic state. So this looks like a post-encephalitic state. This is very important because not only is autism going up, but childhood seizures are going up. Also, ADHD and tics are going up. So they're going up in concert. And so we highlight in the McCullough Foundation report a very important study published by Nielsen, Sweden, 2021. They looked at children in Sweden before the age of 9 who developed a febrile seizure. Now, our CDC has published, a paper by Duffy and colleagues from the CDC has published, for sure, routine childhood vaccines can cause febrile seizures, for sure.
And that's a seizure due to a high temperature.
High temperature. So they take a big battery of vaccines, the kids get sick, and they have a seizure. That Nielsen paper said, listen, if that happens, that child has a 40% chance of converting to a neuropsychiatric disorder. A 40%. Now this is starting to make sense. What percent of kids get febrile seizures? About 2 to 3% per year. What's the leading cause? Taking a big battery of vaccines. What's another complication from febrile seizures? Sudden infant death syndrome. Now, Surgeon General Joe Ladapo in Florida says, wait a minute. Every SIDS case, we're pulling the vaccine records. Burl Hamady, who is a Louisiana state rep, pushed for this legislation in Louisiana. So listen, you can't have the coroner examine a SIDS case without examining the vaccine record, because there's a paper by Miller and colleagues showing 75% or more of all SIDS cases occurs right after a big bundle of vaccines.
Yeah, right, but they don't admit to this, though.
But can you imagine? A child goes home. The parents think they're okay. They put the baby to bed in the crib. The baby later on, the parents are sleeping. The baby later on develops a fever, gets sick. has a seizure, aspirates, or has an apnea, they stop breathing. It's over with.
And by the way, a lot of parents are accused of shaken baby syndrome, and meanwhile, it was many.
They're probably trying to resuscitate their kids.
Exactly. That's kind of what some of the evidence showed.
And so recently in JAMA, there was a prospective randomized trial of giving premature babies the routine battery of vaccines in the hospital versus not doing it. It's a very important trial. Prospective randomized. The children who got the big battery of vaccines in the hospital, they had more apnea events, observed apnea events, and the nurses had to shake and revive the babies. Now we got it. So as we sit here today, the preponderance of evidence suggests that this whole world of vaccinology that we outline in our book has become like a religion, like an ideology.
It's true, it is.
It's gotten out of control. It's too much for some young kids. Now, granted, a lot of children can take this. They can handle it, but there probably are susceptible children who can't. And when they do take a big battery of vaccines, watch out. The horse is out of the barn here. The parents know, and you know what? There's a recent
mothers
paper,
know.
There's a recent paper in JAMA Open Network by Vasuvian and colleagues that indicates 60% of young parents now they're not going through with these vaccines.
COVID did one thing. It got people to question the cash cow, the holy grail of medicine, the vaccine itself, right? So they pushed this too hard. I said they made a mistake here. Right? You know, they tried to take the ground and they took too much, and it backfired on them. Let's get back now. Okay, so the COVID vax, right? I mean, it produced. Let's talk about it. Produced a different spike protein than the natural spike protein, which is now we know with post-COVID, meaning people sick after COVID, vaccinated or unvaccinated. We'll talk about both groups. But this vaccine group, the amount of heart attacks that's been happening, this is your background. So why does it create heart attacks, especially in young athletes, myocarditis, etc.? So kind of explain this to people, because this was, I don't know if they didn't know this was coming, but this has been really pushed down, hidden from the most people in the public do not understand how big these numbers are, and it's pretty scary. Talk about it.
It's very scary. You know, I'm an internist and cardiologist. I'm in clinical practice. I've been seeing this all the way through. I'm the most peer-reviewed published person on this topic in the world. Talking to
you are.
So what we know is that of people who took the shots in the United States, 94% of them took a messenger RNA vaccine, Pfizer, Moderna. These are still on the market. Now,
it's hard to believe, by the way.
The adenoviral vector vaccines, which was Janssen and outside the United States, AstraZeneca, those companies did the responsible thing. They pulled them off the market.
Yeah.
They're gone.
Yeah.
And so what we know is with the messenger RNA, Pfizer and Moderna made a decision early on. Because messenger RNA technology has been around a long time. It's actually from 1985. There's a paper by Lalani and colleagues, British Medical Journal, highlighting tens of billions of dollars poured into this since the 1980s. It didn't work too well.
Yeah, but it's been failures, Because
it didn't work too well because the messenger RNA was easily dissolved by human enzymes, RNases. Pfizer and Moderna saw this, and they said, listen, we've got to come up with a vaccine using this tech. That was the plan. So they tried replacing one of the natural nucleotides called uracil with a synthetic one, nucleoside analog called pseudouridine. They did it a little bit, and it kind of worked, made it a little less resistant to breakdown. And finally, at the end, they said, you know what? We're going all the way. We're going to make this full synthetic. So Pfizer and Moderna were made full synthetic. Carrico and Weizmann won the Nobel Prize for figuring out how to do this. So people got injected with messenger RNA that cannot be broken down by human enzymes. You're stuck with it.
Yeah. So then you get something called spike protein persistence.
Right, because it keeps producing
spike proteins, which drive inflammatory cytokine reactivity, sickness, post-COVID, people that are just what happened to my life. And obviously some of these other tragedies that we're seeing, and even all the way up to turbo cancers.
Right, but you asked about the hearts.
I did.
So and what I've done on this podcast, and I hope everyone appreciates this, is I've cited dozens and dozens of papers by their first authors, so you can look them up. And when I testified in the U.S. House of Representatives about a year and a half ago, the panel that I had just had Anthony Fauci the day before. And I was grilled for hours in front of the U.S. House of Representatives. And just like this podcast, I cited dozens and dozens of primary sources of data. I asked that panel, you just had Anthony Fauci yesterday, how many sources of information did he cite? They looked at me and they said, Dr. McCullough, he couldn't cite a single source of information. Fraud.
Yeah.
Complete fraud.
Yep.
So Crossan and colleagues, Harvard, young people dying after taking COVID vaccine, he finds Pfizer and Moderna messenger RNA in the human heart. It's physically in the heart. You take a vaccine, it's going into the heart. Ballmeyer and colleagues from Germany, young men alive, but really sick with heart failure. He takes biopsies of the heart, the vaccine spike proteins in the heart, and you can tell the difference between the vaccine spike protein and the infection spike protein. The infection spike protein, people just get the tip of it, called the S1 segment. Mm-hmm. The vaccine, they get the full-length spike protein.
Okay, so there's a difference already.
It has 2 proline insertions that hold the spike protein open in the prefusion conformation, and then the spike protein gathers in 3s and forms trimers. The spike protein from the vaccine itself becomes indestructible, and then they circulate in the bloodstream. So we're working with a research lab in Germany at the McCullough Foundation. We have one of my patients who took 3 shots of Pfizer. He's a medically sophisticated person. He works for a big biopharmaceutical company himself. He has suffered heart damage, myocarditis, proven by MRI and clinical exam, blood clots proven to have shot to his lungs. So he clearly has complications. And I'm telling you, 3.2 years after the shots, we found circulating Pfizer and spike protein in his bloodstream.
But it's persistent. I mean, it's just continually producing them. The body can't break these man-made spike proteins down. And I mean, then what's the long-term outcome? We
don't know. So let me give you some leads. The spike protein and messenger RNA apparently goes everywhere in the body. Spike protein has been found in the brain. It's been found in the blood vessels. Yeah. Breaking into the brain is shown by Ota and colleagues. Been found in the liver. My patient, we've sent skin biopsies. It's in the skin. So it's everywhere in the body. Now, spike protein has been found in breast milk in 2 papers by Hannah and colleagues. That's a lead. Breast milk is modified sweat. So it must come out in sweat. Yay! This is great news. One of the big interventions I tell my patients to do, you took these shots, you want to sweat. My patients who are suffering the most from vaccine injuries, they say, Doctor, I never sweat. I never exercise. I tend not to sweat. I think that's one of the reasons why after the initial wave of cardiac arrests in athletes, they've done pretty well. I think they've sweated this stuff out of them, to tell you the truth.
But so why are we seeing this, the heart, the myocarditis, the clots in younger athletes?
Because younger cells take up the genetic material more vigorously. Okay. In athletes, they have myocardial blood flow, so the heart is avidly, they work out hours a day.
It seems to happen like when they're really...
And then a very important paper by Catagiani from Brazil showed, and this is correct, that when you have messenger RNA and spike protein in the heart, and you have inflammation in the heart, it takes a surge of adrenaline to trigger the cardiac arrest. Okay. That's
why the athletes
on the
field, court, yeah.
So we've seen cardiac arrest occur at 2 times. One on the playing field or during exercise, and the other time is between 3 a.m. and 6 a.m. during sleep. And during normal sleep, during that time, the waking hours of sleep, there is a surge of adrenaline. And so, for example, Illinois member of Congress, Sean Castman, he's promoting the vaccine, pushing the vaccine. He's tweeting out, I'm taking my kids to take the vaccine. As soon as it's approved for them, he takes his daughter, Emily, in. And almost certainly she's taken the vaccine. And sure enough, within a few weeks, we get a tweet, my daughter's found dead in bed. And so he has his daughter examined, and they said, yeah, she died of a heart arrhythmia. Now, instead of Castman coming out and saying, oh my God, this happened, I've lost a family member, they were perfectly healthy before the vaccine, instead, his response is distinctive. He says, we just have to enjoy the time we have together. So there is this complete intentional oblivion. He took the shots himself. It's
back to what you said about doctors not admitting when they're wrong about something, right?
Right. Well, once you've done it, and I've seen this time and time again, most public figures who have had clear-cut vaccine injuries refuse to admit it's the vaccine. Another case example, is Deion Sanders, who used to play for the Dallas Cowboys. Now, Deion had turf toe. He's had some changes in his foot from prior surgeries, but he's pushing the shots. He's pushing, he's saying that, if you don't take the shots, you're not part of the team, and you're not doing this for the good of humanity. He gets arterial and venous blood clots. He nearly loses his leg. He has multiple amputations. He's very sick. He makes a docu-series about this whole thing, never mentions the vaccines. The vaccines are proven to cause blood clots.
Absolutely.
It's in all the peer-reviewed literature. It's in the package inserts. So he completely blocks out the vaccines. And what happens a year or two later? He develops a turbo cancer of the bladder. Now he's in his 50s. He's had his whole bladder removed. Oh, God. And still doesn't recognize it's the cancer. Now, what happens to people?
The vaccine.
Well, how about some other public figures? Kirk Herbstreit, my favorite ESPN announcer. He has COVID, long COVID. He takes the shots, bad move, gets blood clots. They shoot to his lungs. He has pulmonary embolism. How about Bruce Arians, former coach of the Tampa Bay Bucks? He takes the shots. He's hospitalized with myocarditis. Now he's in his 70s. How about Al Roker, weatherman? He takes the shots publicly on TV. He gets blood clots. Nobody comes back. Justin Bieber gets a classic vaccine injury syndrome, Ramsay-Hunt syndrome. He hasn't been on stage since that time. His wife takes the shots. She gets a blood clot, goes through the brain, has to retrieve it. The list goes on and on. Damar Hamlin, Buffalo Bills, has a cardiac arrest. I go on Tucker Carlson. I said, Tucker, I'm a doctor. I'm watching this happen. The first thing I need to know is, did he take the vaccine? Because it has all the characteristics of a vaccine cardiac arrest, not because he tackled somebody hard.
Right. Now,
the interesting thing on this is that some patients have gotten defibrillators. One of my patients actually got a transplant. Now, the prototype of a patient who gets destroyed after one shot is my patient. Now, this was published. He's disclosed his name, John Bernstein, and it's been written up in Trial Site News. Now, he had a prior bypass surgery. He had a prior defibrillator. So he has coronary disease. He has a weak heart, but he's a consultant. He flies all over. He's kind of a big shooter in the consultant field. He takes one shot of Pfizer, gets a myocarditis. Now, he's not a pro athlete. He takes one shot of Pfizer. He's in cardiogenic shock within 8 hours. Oh, God. He's airlifted into Emory University Medical Center, has a transplant, has an infection in the chest, has a stroke. So this guy used to be a consultant. Now he's I
have a friend who got it, ended up with a stroke.
He's trying to recover. And I get a call from John Bernstein from a hotel in Atlanta, Georgia. He says, Dr. McCullough, you got to help me. I went through all this. He tells me his story. My transplant team wants me to take another shot.
Oh, my gosh.
Now, that tells you that they've lost their minds. I said, a second shot will kill you. It will kill you. It'll ruin your transplant. It will kill you. They've lost their minds over these vaccines. They've lost their minds. Joe Rogan has several friends that have needed pacemakers. Well, the interesting thing is the case of pilot Snow. This is a great story. So he doesn't want to take the shot. Pilot for American Airlines takes the shots, knows he could be in trouble. He lands a big plane at DFW Airport.
Thank
American
God.
Airlines gets off everyone's getting off the plane. They're kind of tidying things up. He's on the jetway. There's just a few stewardesses there. Boom, he's out. And I've had a chance to talk to him, examine him. He said, listen, doc, when you go out of the cardiac arrest, it's lights out.
Yeah.
It's lights out, and everyone's scrambling, and one of the stewardesses has the awareness to pick up her phone and call 911. Now, it turns out DFW Airport always has 2 circulating paramedic units. I know because I know one of the guys is my patient. The miracle of pilot Snow is the paramedic unit happened to be at the gate next door, tending to somebody else. They were right there.
Yeah.
So when they called, they just scrambled over to the jetway, found him unconscious. It took 6 shocks to get him back, and they got him back.
Wow.
So now Snow is in the hospital in Dallas. He makes a video. He pulls up his gown. He's all fried from getting 6 shots. He goes, this is what the COVID vaccine did to me.
Yeah.
So he tells the truth.
Yeah.
Later on, he gets a defibrillator, and I see him, and I ask him an important question. Now, by this time, he's on McCullough protocol, base spike protein detoxification. So he's on the ultimate spike detox from a wellness company, which is the only scientifically supported way of getting this out of the human body. He's on this. He's on an important drug that's necessary called colchicine, a prescription drug. And I asked him a critical question. I said, has your defibrillator gone off again? He said, no, doc. And when Damar Hamlin went down, knowing this, Myself and a cardiologist, Michael Gutkin, we wrote the Buffalo Bills doctors. We wrote the Buffalo Evening News. We said, listen, we know Hamlin has probably had a vaccine cardiac arrest. Be sure he's on the right approach, because I think the athletes can get out of this without needing a defibrillator. And I've been right. So Hamlin played 2 more seasons. He's now out on an injured reserve with a pectoral muscle abnormality injury. But there's another athlete, Vince Iwichuchu for USC. He had a vaccine cardiac arrest. He got a defibrillator. Now, LeBron James' son had a cardiac arrest. He didn't. He was able to dodge it. So, but these athletes will not come out, admit it's the vaccine.
It's amazing. It's amazing. But and look, arguably, I mean, what's driving it is the spike protein. Yeah. Let's be clear. To your point of, by clearing the spike protein, you're able to mitigate a lot of this.
We believe.
Okay, so if the body's persistently producing a spike protein, if you're vaccinated, then you would arguably have to keep this process up. You'd have to keep reducing the spike protein.
You have to get ahead of it. Now, recently we've had enough published data. We know the antibody to the spike protein correlates with spike protein itself about 0.8 to 0.9. Labs are coming along to be able to directly measure the spike protein in the bloodstream. That's going to be great.
Yeah, we were discussing that earlier.
Yeah, that's
right?
going to be a big advance. So everybody should get their antibody to the spike protein. LabCorp allows this to be measured without a doctor's order. That's how important this is.
Yeah.
So you go to LabCorp.
And you want your antibodies to be just
below 1,000 binding
1,000
units. But go to LabCorp, Lab on Demand, on the website, infectious diseases, COVID antibody test. Order your COVID antibody test, pay $69, go to LabCorp and get the test yourself. Many doctors will not order this. They categorically refuse to acknowledge this. Get your test. If you're below 1,000, you're in the free and clear. If you're above 1,000, we start to worry. Over 5,000, we're consistently finding spike protein in the bloodstream. 10, 15,000, 25,000, trouble, watch out. There can be a new blood clot, new cardiac arrest. And let me tell you, it's not just the vaccine. I've had several patients who have had COVID, and they've come in with blood clots from their ankle up to their hip, bigger than we've ever seen before. No vaccine. Yeah.
Well, I'm in a group. We're studying it, right? Yeah. They're bringing in this information from Europe, even a test that's measuring exact spike proteins that hopefully will be available soon. I don't know, maybe another year. But the bottom line is we're seeing, of course, the spike proteins, you are kind of explained this, that are from the vaccine with a double proline, the full length. And then the group that just got COVID still has a spike protein. So I think the disturbing part is we're still having a lot of people who didn't get vaccinated in what we call long COVID, that their bodies seem to have produced a lot of spike proteins, still sick after COVID. Kind of explain that.
The virus may have had a deeper installation of itself in the human body, and there's a theory, and I think it's pretty solid, of what's called a SARS-CoV-2 reservoir. And there is a paper by the NIH from Chertow and colleagues of people who died of COVID, test positive anytime they died a year later, they still had the virus alive in the body a year later.
Wow.
And there's a GI study in pediatrics, about 5 months, they can find the virus in the GI tract in some kids who are sick. So clinically what I do is if there's any craniofacial symptoms like headache, lancinating pain, loss of taste and smell, hearing or vision loss, headaches, persistent pulmonary findings, particularly if you see something on X-ray or CT, skin rashes, that indicates the virus is still in the body and replicating, and that's the application for ivermectin. So that's in long COVID, I use ivermectin, I use full dose. Someone your size would probably take 36 milligrams for 90 days.
Oh, wow.
So we have to knock it out. And so, there's an art form to treating long COVID and vaccine injury syndromes. That's what I do in my practice. Other groups have arisen to do this. I think, modern allopathic and even naturopathic medicine, they need to get on board with this. The spike has to be removed with enzymes. Other things don't remove it. A non-enzyme will not remove it. So enzymes, that's nattokinase, bromelain, maybe sereptase, maybe papain, maybe lumbrokinase, but for sure, nattokinase and bromelain. We have such a clinical experience, and we've published on this. The antibodies go down, spike goes down, they get better. We've got that locked down. N-acetylcysteine may denature it, maybe render it a little bit more amenable to clearance. Ultimately, it is clear.
Well, it would help mitigate some of the symptoms because people oftentimes get symptoms in the first week or two getting rid of these things, which is normal.
That's correct. But because it keeps circulating around, I personally had a high antibody level. I detoxed. It's now down to a safe level below 1,000. I still take it. I take it on an empty stomach. So I got up last night, early this morning. I took 4 capsules, which is the standard out of the bottle dose, and we've increased the dose over time. We intentionally, by the way, did not patent this at the Wellness Company. We did not patent Ultimate Spike Detox. Why? There's too many people in need. And if you go on Amazon, lots of companies have put together different products. It's terrific as long as you know you got nattokinase, bromelain, curcumin. This is the standard. Now, it is copyrighted in my name, and I copyrighted this as well as the early treatment protocol for a reason. It's for accountability. And when I first devised this, and I published it in the Journal of the American Physician and Surgeon, and later on in Curious Springer Nature Journal, I first published the concept of getting rid of spike protein. I'll never forget on Instagram. I posted it. Immediately it got a community warning. It said, this doesn't work.
Yeah.
How did they know it doesn't work on the very first day? The point is, this is a little spooky. The bad guys knew it was going to work. They were waiting for someone to discover this.
Yeah, well, they don't want anything other than the vaccine, of course, especially something or somebody that's promoting the vaccine is causing spike protein persistence. Yeah, that's not going to go over well at all. Yeah, look, okay, so there's some solution, right? Because the fact is we have people post-COVID. Some of it is a cellular danger response, literally, where the body just went into a stress reaction. This virus was foreign. Our immune system never saw such a stress like this. And these people are left with dysautonomia, where, now the thyroid, the adrenals, and, they're just not right. So this post-COVID thing, it's multifaceted, it's multi-leveled.
For sure. Yeah. Now, it's been my experience as spike protein indices come down, virtually all of these get better. But each one of these syndromes, it's a bit of an art form to handle.
You're right.
The dysautonomia or this POTS or posterior orthostatic tachycardia syndrome, I have found that is probably a manifestation of subclinical myopericarditis, believe it or not. So the heart and the blood vessels, the sympathetic chain and the cervical spine, they're all impacted. So my go-to drugs are, we always use colchicine, which is a unique anti-inflammatory. It's a prescription drug, but it's broadly approved for using in pericarditis, gout. Now it's anti-atherosclerotic. So colchicine mandatory and spike detox to handle the fundamental problem. And then for symptom management, I have found, believe it or not, the go-to beta blocker is Nadolol, which has intrinsic sympathomimetic capabilities. So it allows young people to modulate. And then a blood pressure support, which is a naturopathic approach. And I've tried everything, but the go-to naturopathic is actually to use adrenal cortex from animals. So,
and that would help even the dysautonomia, the cellular danger response in general.
Yeah. You got it. And of course, colchicine helps with this cellular damage as well. So it actually works within granulocytes. And I think nutraceuticals and supplements play a role. We, broadly on the cardiovascular perspective, have found that ubiquinol, but in high doses, 600, 800 milligrams a day, L-carnitine, certainly the B vitamins, we flood patients with the B vitamins. Vitamin D, every single study on vitamin D is positive, both in acute COVID and in recovery and in
that affects the immune system. It affects your hormones in general. Yeah, so
there you go. Yeah. So it's all part of the package. Listen, it's been so great to be on your show.
I know you have a flight to catch. I have to leave with this. Somebody can see, because we know that the more boosters, the more risk people are at, right? So what would you tell people that are considering taking another booster, another vaccine, or even the next vaccine? What would you say to those people?
I would tell them at this point in time, don't look to your government to save you. It's clear. There's not a single government in the world that's going to take these off the market. They're not going to. I don't care who is in there. There's some type of powerful force at work. Even Robert F. Kennedy, the most concerned activist about vaccines now, is essentially in the vaccine camp advocating for more vaccines. So what's going to save you is independent research. Look to the McCullough Foundation. Look to this podcast and where so many other experts come on. Do your own research and, be wise in your choice. I can tell you, America's already spoken. No one's taking these shots. Do you know what the recent ACIP panel it was revealed by the CDC, only 10% of healthcare workers are taking them.
Yeah.
Some of them are still mandated to take them. Many of them are fulfilling out exemptions. The public is not taking COVID vaccines. I've already told you 60% of young parents are pulling away from the routine child vaccines. We can always treat infectious diseases. The infectious diseases of the past with poor nutrition and poor living standards are not the same threats today. We've got this. 12 studies show a healthy child born today is healthier if they're completely unvaccinated.
Do the masks stop the virus?
Masks do not stop virus, but nasal sprays and gargles do.
Yeah,
so when I go to the airport in a few minutes, I'm going to do my nasal spray, do my throat spray. I'll do it when I get home. That stops the virus. A virus is in the nose for about 7 days. You never feel it. Is replicating. The lymphatic stream back to the throat. Your first sign is a sore throat. You've already had it for 7 days. You've had 7 days. You could have kind of reduced the inoculum, have your immune system take over. Those who use nasal sprays and gargles twice a day routinely go years and years with no colds or flu.
And by the way, you're spreading the virus when you don't even know you have it. Typically, by the time you have it, it's probably less. Yeah. Okay. That's the advice. I mean, honestly, there's the truth. Is shedding real?
Shedding is real.
Okay.
It probably is just, boosting our antibodies against spike protein. It can influence menstrual periods. People with lots of close contact, it's real. But it comes through exosomes. It largely comes through exhaled breath. So use your nasal spray and gargle. Stay on immune defense. Share
this podcast. People need to know the truth. Get the books, right, on Amazon?
Get them on Amazon.
Find out more about you? Point them in the right direction.
Yeah, go to petermcculloughmd.com. That'll take you everywhere. Go to Amazon. Get both the books. Vaccines is a New York Times bestseller. Make sure you sign up for Focal Points every day. That's my Substack. That'll give you updated. I cited dozens of papers today. I do it because I am a top scientist in this world, and only the top guys can do it. You listen to other people, they can't actually locate the data in their mind. I do, and I do it every day on Focal Points. Sign up for my podcast, America Out Loud Talk Radio, McCullough Report, every Saturday and Sunday, 2 p.m. Eastern, as well as Pulse, which will come out today on Wednesday evening. And make sure you follow me all over social media. I've got the top set of doctor accounts broadly across social media. And like you, I cannot be stopped at this point in time. Neither can you, because you have the truth.
No, they already tried to take you down. Yep, over. Yep, you're out there now. Share the show, like it, share it. People need the information. Thanks, man.
Thanks.
Yep.